COVID, what we owe to each other. Welcome to this session, especially on a day when Zoom is crashing all over the world. I'm glad that all of you made it here in whatever way that you did. My name is Bryan Pilkington, and this is the start of the second season of the COVID Ethics series presented by IHS Bioethics, IHS Student Life, and the IHS Library. I teach ethics at Seton Hall, at the School of Health and Medical Sciences, the College of Nursing, and occasionally they let me in the philosophy department. I also teach in the Hackensack Meridian School of Medicine. We began this series in March to discuss ethical issues arising or intensifying due to COVID, with the belief that ethical challenges are best addressed by a group of folks from diverse perspectives, practically reasoning together. You can check out our old episodes, the episodes from our first season, on our webpage, and we'll put that up later. It's library.shu.edu/COVID-ethics. In the first season, we discussed racism, safety, duties to care, vulnerable populations, sports, and a host of other topics associated with COVID and ethics. Our second season begins today, fittingly on the first day of undergraduate classes at Seton Hall, and we'll be focusing on the ethical foundations of our behavior during a pandemic. I'm very glad to have four excellent colleagues join me for our discussion today, where we will work through ethical foundations associated with pledges, oaths, and codes of ethics that underlie individual, professional, and community responses to the pandemic. Again, for those of you just joining us, please mute your mics and videos. Questions, if you have any as they arise, can be sent through the chat, or you can tweet them at us at SHU Bioethics on our Twitter handle. It's a great pleasure for me to turn to our first panelist, Professor Thomas Cavanaugh. Professor Cavanaugh is a philosopher by training. Sorry, Tom, we've elevated you to an MD from a PhD. He's a professor at the University of San Francisco and has written what I think is one of the best books in the past few years on medical ethics. I've got my prop here. So I encourage all of you to check out Hippocrates' Oath and Asclepius' Snake, which Tom can correct my pronunciation on, The Birth of the Medical Profession. So Tom, in this book, you go deep on the Hippocratic Oath. So I was wondering if from your work on the oath and from your vast teaching in bioethics, if you could just for a few minutes help the folks at home think through the role of the Hippocratic Oath in the profession of medicine, how it might apply during COVID, and sort of just any insights you could offer about sort of community ethics during this time.
Oh, thank you, Professor Pilkington. Again, I am a professor of philosophy and have a doctorate in philosophy. I'm not a medical doctor, but as Bryan mentioned, those who practice medicine, nurses, doctors, affiliated professionals, often have associated with the practice of medicine a promise, and that practice, we can date that back to the very beginning of medicine with Hippocrates. And if we look at those promises, they're not everyone takes the same promise, but generally speaking, promises include a commitment that we find in the Hippocratic Oath, where the juror, the person who's making the promise, the student, says, regimens I will use for the benefit of the sick according to my ability and judgment. And that's a very core commitment that we find in pretty much all promises, whether it's of a medical doctor, a nurse, anyone who's committed to the profession of medicine will have a promise similar to that. It's very generic, and you can see we're using regimens or medicine for the benefit of the sick according to one's ability and judgment. So the promisor, the juror, the one who's going to become a practitioner, is making that promise to learn, well, what are the regimens? What are the medicines? How will they benefit the sick? And then, of course, to practice medicine, right? And practice makes perfect, and to develop ability and to develop judgment concerning medicines that will be for the benefit of the sick. Broadly understood, when I speak of medicines, regimens, is all in an all-encompassing term in the Hippocratic tradition. So that's on the one side of the commitment there. We have the promiser, the one who's making the promise. And then, of course, that promise is being made to a community. It's being made to teachers of the profession of medicine. It's being made to the sick. And it's also being made to the larger community, the larger society, which is entrusting the good of health to this profession. And so the community, what kind of, on the one hand, we have the professor, the one who makes the promise, right? The professional has made a commitment to learn about medicines, to use them for the benefit of the sick, and to develop expertise and to develop ability and judgment in the use of these medicines for the benefit of the sick. On the other hand, society is going to grant the professional the privilege, really, the special ability to study medicines, to test medicines, to figure out how will they benefit the sick, to also develop ability and judgment. And so on the other side of that promise, we have the recipients of the promise. Society, very broadly understood, has to allow the professionals to learn what medicines benefit the sick and to develop ability and judgment. Now, so society kind of, in a sense, on its side of it's entrusting the good of health to the professionals. Amongst, there are many other goods that society is concerned with, goods of justice, goods of peace, all those other goods of prosperity. Those are other goods. Those are not really being entrusted to this profession. They're entrusted to other professions. But this profession is being entrusted with health. And so society will defer, has some obligation here to defer to the profession as that profession has been entrusted with the good of health by society, so that the profession can discern what medicines are useful, how are they useful, what is harmful, what must we avoid, right? So when we think of the COVID and the pandemic, of course, we have the profession, broadly understood, of medicine, of nursing, and the allied professions are devoting themselves to the benefit of the sick, using their ability and judgment, developing ability, developing judgment, learning new things. And society has to allow these professionals to exercise their judgment and to develop these abilities in the service of the sick and of society more generally. So that's kind of the very, very broad, if you will, what is owed in terms of this tradition of promising and of professionalism. The professions, in a sense, they've committed themselves to benefiting the sick, and then the society is deferring, if you will, to those professionals, allowing them to discern and to figure out, well, what is beneficial to the sick? And what must we do in the realm of health to protect one another? And we have a deference that is owed to the professionals in light of their commitment to benefiting all of us insofar as we are subject to sick and healthness and being healthy. So let me let that serve as an introductory answer to that question.
Thanks, Tom. That's super helpful. And the framing's excellent. And sort of picking up on your last point, in deference to the professions, sort of understanding the ethics associated with some of these questions, we'll turn to a member of those professions. So our second panelist, Sherry Greenberg, a colleague of mine who teaches at our College of Nursing at Seton Hall. And I'm so, Johri, I see now you're excellent. So glad that you're here. Thank you for joining us. So we've moved from the big philosophical, ethical framing of what we might owe to each other in light of Professor Cavanaugh's comments on society and individual practices. I was wondering if you could offer from the nursing perspective, and I know you do also a lot of interprofessional ethics work. So from the nursing perspective, from that interprofessional perspective, help us think through some of these big issues.
Well, thank you for having me today, and hello everyone. Happy Monday. And I will say that this year began in January as 2020 as the year of the nurse and midwife in honor of Nightingale's 200th birthday back in May. So this was very exciting for nursing as a profession this year. And we had no idea what was to come ahead for nursing and all the health professionals this year. And I think as a general overview, what we owe each other is really communication and collaboration to start. I think it is very important. We've learned through, and I'll be very COVID specific, we know day to day that ethical decision making can be challenging on a good day. And my specialty is in gerontological nursing and care of older adults in general. And so in geriatrics, there is this feeling of interprofessionalism, and I'm sure many of you who work with different age groups feel the same way throughout the lifespan. But that in the time of COVID, there have been some difficult decisions that have to be made. And I think that a lot of what we've seen has, in some geographical areas, varied over time. I think we've seen a lot related to inpatient care. We're aware of shortages and issues related to PPE, protective personal equipment, and ventilator use, and difficult decisions about who goes on a ventilator if one needs to choose. But that it's not just about inpatient care. We need to look at the continuum and about outpatient care and nursing home care, and that there have been some very difficult decisions and issues that I think have come to light during this time of COVID that in some respects have been there for a long time. So in nursing homes, for example, staffing issues and reimbursement have come to light, and this might be a nice opportunity, if we can take a nice opportunity from this, as maybe realizing maybe there should be more staffing of registered nurses and more attention to ratios in nursing homes, and that there could be some policy change down the road. That would be a positive outcome from some negative issues that have come to date. We owe each other professionalism, and we have to remember that ethical considerations are applicable at all levels of care and all levels of education and all levels of work. So from undergraduate teaching in any of the health professions, teaching professionalism throughout the curriculum, and then into practice, whether it's at a bachelor's level or a master's level, or even at the doctoral level, and taking this through from practice, education, and research, and keeping those threads throughout. And we owe each other honesty. If we're having trouble, we need to communicate. We need to collaborate as well, and support each other, I think, are very key pieces. You mentioned before about the Hippocratic Oath, and in nursing, we have the Nightingale Pledge and the American Nurses Association Code of Ethics that we abide by, and scopes and standards of practice. And in nursing, which are open for public opinion, they're being updated as we speak right now by the American Nurses Association. So nurses can put in their public opinion for comments before that is finalized in the next edition. And then there are some specialty areas. So we are all bound by some aspect of our profession's ethical standards. And it is, I think, some of the threads throughout the professions are similar: being safe, do no harm, advocate for patients, caregivers, and caregiver needs during the time of COVID, I think, have been highlighted as well. And the different professions, I think, have, from what we've seen, really worked very well together to accommodate needs when loved ones can't be with their loved ones during an acute illness and during time, depending on where they are at the time. Visiting has been an issue. So, we have a responsibility to each other amongst the different professions, but also to our patients and their caregivers and families, and making them feel a part of the care as opposed to feeling alone. And I think some of the messaging is important too. We've all gotten very used to keeping a social distance of 6 feet. And I wish we can go back in time and called it a physical distance of 6 feet, because that 6 feet is a physical distance. And sometimes I think the social isolation that people are feeling, some of that is geared to some of that language, but we're here now. But I think when we're really, that's something that we can, I think, help people in general, whether they're patients or our friends or our neighbors, keep that in mind. We want to promote socialization and collaboration and friendship and support. and comfort for each other. I think those would be some of my takeaways from the last few years. And you mentioned equity before. That's another, we could talk about any of these topics for a whole semester, but equity in terms of who gets what care, when and how, and telehealth and self-care. And I think we need to all keep those general principles in mind. And we also have a responsibility to ourselves, keep ourselves mentally and physically healthy, to keep being there for others as well.
Sherry, thank you very much. Super helpful to sort of, especially for those of us who are not sort of well-versed in nursing practice, to get the sort of on-the-ground real perspective. And I just want to highlight 2 points that you made. One is the importance of communication and honesty in terms of the interprofessional focus. And that'll be a nice segue to our next panelist. So thank you very much for that. But also to highlight some of our previous conversations, which you've drawn us to. The host of ethics topics associated with COVID are not all new. There are many new topics, as you've noted, but like the situation in nursing homes is not a new ethical challenge, right? It's not a new practical challenge, but maybe, and I hope we can all do this, sort of use your framing of an opportunity to sort of do better, not just with respect to COVID, but with respect to a host of things. So thank you very much. And with that need for good communication and a focus on honesty, I'm going to turn to our next panelist, Professor Nalin Johri, who's the acting program director of Seton Hall's MHA program, where he's an assistant professor. Nalin, great to have you. So you've heard a philosopher sort of lay out some of the deep ethical framing. We've heard the practical approach from one of our nursing colleagues, and the importance of communication and sort of the host of issues. From a healthcare administration perspective, help us think through some of this, especially with all the different moving parts that are going on in terms of our ethics and what we owe each other during this time.
Great. Thank you, Brian, and good afternoon, everybody. So just like what we have heard about ethics in the context of medicine and nursing, ethics within the healthcare administration field is guided by the American College of Healthcare Executives, and they have a very broad code of ethics. This code of ethics is something which covers the profession, the students in the profession, and anybody who wants to be aligned with this profession through several ethical policy statements, as well as a free self-assessment. So let me just explain how this is very broad and how it interplays potentially with the other professions also. So when we look at the commitment of ACHE, that's the American College of Healthcare Executives, to ethics, in their commitment to ethics, they do speak about how these are very broad because they're going to be covering the conduct and behavior of future healthcare administrators. So it covers the teaching of students as they prepare for these professions. It also is seen, and I quote from their commitment to ethics, as a beacon in times and situations of uncertainty, i.e. the COVID-19 pandemic that we are just going through right now. The 6 areas that the Code of Ethics covers includes, number 1, the profession. It includes secondly, the patients and others who are served by this profession. It looks at ethics in the context of the organizations that these healthcare administrators work in, the employees that they are working with. Fifthly, it's the community and the society that the healthcare administrators work with. And lastly, the responsibility to really report violations of this code. Within the 9 topical areas that the ethical policy statements from this Code of Ethics cover, there are at least 2 that directly apply to the COVID-19 pandemic. And these would be policy statements related to decisions near the end of life, as well as ethical issues related to the reduction in force and staff shortages. So there are very specific statements that are aligned with trying to really provide some guidance, that beacon of light in times such as this, the COVID-19 pandemic. And lastly, what the ACHE Code of Ethics also covers is a free self-assessment tool, which is available from the website, and which all students, healthcare professionals aiming to be administrators are free to take. It's something which is the statements which cover all the code of ethics, the 6 areas that are there, and you're able to really track how there are some red flags that may be raised because of the way you respond to particular questions. And they've got great resources that are linked to how you could respond to these red flags and try to really cover them. So these are some ways in which the profession of healthcare administrators really tries to cover the context of ethics. And I think it interplays very well with the ethics in the context of medicine and nursing that the speakers before me have so eloquently spoken about. So I'll stop at this time. Thank you.
Thanks, Nalin. That's super helpful. I mean, for a variety of reasons, but I want to focus on 2, just draw the audience's attention. 1, to yet again how the ethical codes are rooted in particular professions, and also how we see slight differences in the way that the particular profession's codes of ethics are articulated, which is just, I think, interesting to reflect on. I guess the second, or sort of really the third point, is that each of these codes of ethics or pledges or oaths at some point relate particular persons in a profession to the broader society, which is a relationship we need to think about when we're answering the question, what we might owe to others. So thanks very much, Nalin. That's very helpful. I'll now turn to our final panelist, Professor Linda Siracusa, who teaches in the Department of Medical Sciences. She's a colleague of mine there at the Hackensack Meridian School of Medicine. Linda, it is great to have you. We're going to ask for Linda's perspective on these subjects. Linda, I know you've done a lot of work in advocacy and student advocacy. We've had a bunch of questions, we've had a number of comments come in and a couple of questions sort of orienting us towards students. So I may turn you there after, but give us your big take on these tough questions.
Sure. Thank you so much, Brian, for asking me to be a member of this panel. In terms of thinking about social advocacy, we think about the idea that there's value to our society as a whole when the society defends and upholds the rights of people in the community who are not afforded the same dignity due to disadvantage or discrimination. And from the Universal Declaration of Human Rights, we know that all human beings are born free and equal in dignity and rights. They are endowed with reason and conscience and should act towards one another in a spirit of brotherhood. It is this that advocacy focuses on. It's all about how we can help at the population, the public, the community, and the individual level with respect to COVID and the pandemic to improve health across our nation as well as across the world. In thinking about what we can do from our own home while we are quarantined, essentially, we can write letters and messages to our federal, state, and local officials, and even internationally, to understand and help them not just with the problems that the pandemic brings, but with solutions that will help ensure the health and well-being of everyone. There are so many topics one could get passionate about with respect to COVID-19, and I'll just pick a few. First, in terms of health disparities, COVID-19 has hit Black, Hispanic, and Latino populations much harder, and the poor much harder than other populations. And I cannot forget the Alaskan Natives and our Native Americans, whom 1 out of 4 do not have running water in their homes. And so how can washing their hands, this simple act, help prevent the spread of COVID when there is no water in their homes? Another topic mentioned earlier was personal protective equipment. And as we face the fall and a potential second wave with the flu on top of that, we know that we need protective PPE. across the US in different places, and we can advocate for that. Across the news lately is our United States Postal Service. Back in 1775, Ben Franklin was appointed the first Postmaster General. And we know we need the post office because it delivers medicines to people. It allows them to send medical tests to be worked on through the mail. It provides many support funds, Social Security to elders, and of course, our most recent concern, the right to vote, which the mail is an essential part of. We also face the question of what to do with our schools, how and when to open them, how to open them safely, how to maintain the health and well-being of our children, whether or not one chooses to have their children go back to school. All of these are just a subset of the many questions and challenges that COVID has brought to all of us. And in so doing, in so choosing to send messages to our leaders, we want to help them do the right thing, help the population, and help the world as well. In sending messages, you can use email, you can use internet, you can use the postal service, and even phone calls. And I've given Bryan the governor's roster for governors across the United States, if anyone would like to reach them. It's really important when we look around to understand the challenges faced, not just by ourselves, but by others across the United States and across the world, and to try not only to let your voice be heard, but to bring to bear your knowledge, your ideas, your vision, and share not just the problems, but potential solutions to these problems that will help ease the burden that the pandemic has brought to us. Be creative, be constructive, but most of all, believe that one person can make a difference. And that's a quote from Raoul Wallenberg. Thank you.
Linda, thank you very much. You've helpfully sort of highlighted the breadth of issues, and I think interestingly pointed us to maybe a tension or at least a possible discrepancy, which we took up in our very first COVID ethics session. Sort of the role of medical practitioners, of healthcare practitioners, and also the role of healthcare and medical students within sort of their professions or as their learning professions on the one hand, and also sort of broader social responsibility, right? So my actions sort of qua doctor or nurse as opposed to my action qua citizen. And that's, I mean, the host of issues and sort of how integrated we are is clear, right? And COVID makes this the case. I was wondering if, and I'll start with you, Linda, and then I'll bounce around to our other panelists, if you had any, in addition to what you've laid out, if you had any words of wisdom or sort of things you think students in particular, as this is our first day of undergrad classes, and I know a bunch are on the line, anything that students should be thinking about in terms of what they owe to each other as they return to school?
Sure. Students are in that unique situation of learning for the future, learning everything they need now in order to be able to go out and serve the medical profession in so many different ways. And in so doing, to ensure that they all get there together, they all ensure the safety and well-being of each other. That's what I think our students could do. And also, our students are so creative and innovative that together they can come up with ideas that may be helpful in terms of fighting the pandemic. And we would welcome that and welcome the sharing of those ideas freely to help others.
Excellent. Thank you very much, Linda. And I guess a shameless plug for some of the work we've been doing. Linda and one of the medical students, Clara Chen, actually have a letter writing campaign, and Linda alluded to this. So we have some resources where you can direct those energies in sort of a very safe way on our website. So I'm going to move down to Sherry at the moment and see Professor Greenberg. Any particular thoughts for the students who are joining us, what they can do, what they might owe to others during this time?
Oh, I always have something to say to students. This is an exciting time across the world as the semesters, our new academic year is beginning now. And I always say, you know, you bring a fresh perspective. Even at whatever year of study you are, undergrad, grad, doctoral, like I said before, it's a fresh new beginning. You bring a fresh perspective, a new light to folks. So come with a positive attitude. Come with being ready to understand that change is constant, especially during this time. Be flexible, be open to new ideas, share your new ideas with others, and be a force for positive and set an example. And I think, you know, for all of us, we need to be flexible. But I think as a student, if you are a student in the health professions, I like the comment that was said before, so I'm going to repeat it. One person can make a difference. You might be in a clinical site with a patient. It might be a caregiver on the phone with you. You might not be able to be in a clinical setting. You might be doing a clinical telehealth visit or what have you. Every touch point is important at whatever point it is. You make a difference. Sometimes just being there, being support, and is very important. Sometimes a moment of silence is also important, and that thinking time and caring time is evident in that way. So come with your fresh perspectives and positive light, and just remember you make a difference. And to the faculty as well, we really enjoy the engagement and sharing of new ideas and sharing of knowledge and new evidence over time. So with research comes new evidence, and remember, there's a lot of rhetoric out there. There's a lot of truths. There are a lot of non-truths. So remember the evidence base as best one can apply it.
Excellent. Thank you, Sherry. Any nod to the faculty is, of course, always welcome. And the evidence base is very, very helpful. I want to shift to the other side a little bit and bring Tom Cavanaugh back in here. So we've had a wide range of possibilities where, especially as Tom, as we're still focusing on students, where students think that they might contribute. But in thinking about professional ethics and maybe a little bit more of a philosophical orientation, how much can we ask of docs and nurses and other healthcare folks? At some point, have we sort of pulled in, or do we ask too much of them? Tom, if you could comment on that in light of sort of the role of the Hippocratic Oath, or more broadly, that would be really helpful.
Brian, so if I understand your question, right, what is it legitimate of society to ask of the professionals? What is it legitimate? And so I think that the oath, just taking the Hippocratic Oath as one instance of a pledge or oath, promise, code, there's that phrase of according to my ability and judgment. So it seems like the professionals acknowledge their own limitations in those promises, at least as we see it in the Hippocratic Oath. And so that seems like that's the appropriate boundary of society's, what society would ask of the professionals, right? That is, so the professionals can tell us, well, what are you, what are the medicine, what are the regimens, and also, what are the boundaries that you've discovered concerning your abilities and your judgment? And that society should respect those boundaries that the practitioners themselves have discerned in the practice of their profession. So I would say that's where society should, in terms of when society's asking, when we ask ourselves, well, what can we ask of the physicians, of the nurses, of the allied health professionals? We should really pay attention to their own discernment, those professionals, how they discern their expertise in the good that's been entrusted to them, health broadly understood, and the care of the sick. That's where society should govern its own requests that it makes of the professionals. that's kind of a point of departure, I think, for society's requests that it makes of the professionals, those things that the professionals themselves have discerned as within their ability and judgment, and within safety and all those kinds of other issues. So hopefully that is in the neighborhood of your question there. Bryan, I think you may be muted. Yeah.
There we go. Thanks, Tom. So you're moderating and contributing. This is great. So no, you answered the question really well. And I have a number of other follow-up questions that maybe we'll pivot to in a moment about sort of disagreement within professions in light of the fact that deference goes to the professions. But I think that'll take us a little far afield for the moment. So let's pause there. And thank you. That was helpful to know, or sort of for us all to reflect on, especially of the non-clinicians on this call, but not foisting too much on practicing professionals or sort of shaping their own views. And thinking about, and I want to turn to Nalin here, thinking about what health professionals, sort of very broadly speaking, have gone through and thinking sort of throughout the time of COVID. Nalin, is there any resources from the sort of healthcare administration perspective, either for administrators themselves or sort of how do healthcare administrators think about taking care of or guarding the safety of the docs and nurses and janitorial staff and everybody sort of around during COVID, right? Again, with the background, how much is owed? How much can we expect people to give up? So that was a bit rambling. Does the question make sense?
It does. And I think if I understood that correctly, the way I would probably respond to it is at two levels. One is that health administrators, they are also guided by the code of ethics, and it is very specific in that it refers to patients and others that they serve. So that is one of the stakeholders that are there. It also includes the organization. It includes the employees and community and society at large. So therein, there is a frame for addressing ethical issues that may arise. And in trying to really respond to those ethical issues, the self-assessment that I referenced earlier in my talk is something which has been developed as a Likert scale. So you can respond to it like, do you usually do this behavior or not, according to each of these 6 areas of the code of ethics. And if that brings up some red flags, like for instance, like if there is a question related to staff, if that is something that you usually do, but maybe not always in trying to really respond to their ethical needs that are there, that might be a red flag that needs to be addressed. And there are resources that are tagged to these different areas of the self-assessment. So that would be a great place to really start this process of really taking the responsibilities and addressing the ethical needs of employees and others that work in healthcare organizations, including other teams that are there.
Excellent. Thank you, Nalin. And it's always great to have professors on the line who keep reorienting us towards, right, the key foundational principles and where we can go for those. I'm going to pause here for a moment, just let everyone know we have some information coming in through the chat for all of you, and that we are open. You're welcome to email, tweet, or send more questions for our panelists into the chat. We still have a little bit of time to pick their brains. As those questions come in, I want to reorient us a little bit toward sort of best practices, or how from your professional roots or just in your own thinking about healthcare professions, what's the best response to folks within our society who may not be responding to the challenges of the COVID pandemic as many of us might hope? So the easy case is one case is the person who refuses to wear a mask. And there's sort of more complicated and nuanced socio-political cases raised by some of our panelists already about the post office and some other things that we can get to. But I'm going to pivot back to Sherry. So Sherry, if you could, from the nursing perspective, from your own professorial perspective, having dealt with people, I mean, you have somebody who doesn't want to wear the mask. It's annoying, who doesn't want to wash their hands. You know, and everybody means well, right? Deep down, we're all good Aristotelians. We know everyone means well. They just don't get it right all the time. Any effective tips for us, especially as all our students are coming back? Maybe, hey, help out a friend in a nice way to put the mask on and all of that.
Yeah, these can be difficult situations at times, whether it's professional or personal side, experiencing challenges. Set an example. I think, you know, if you're demonstrating the wearing of the mask and the washing of the hands and gentle reminders about why we're doing what we're doing, and reminding that this is a public health crisis, this is a pandemic, this is not, you know, rules set forth by an individual or an organization or a healthcare facility or a university. These are here for a reason. They're the best practices we know for now, and keep focusing back on the public health piece and the pandemic piece. It's no one's fault. This is just where we are. Well, we'll let that comment lie for a minute. Accept it as no one's fault in particular, but we're trying to do the best we can in the current situation to move forward. So I really do think that setting an example, a positive attitude as much as possible. If someone is not following the rules, then I think at this point, many organizations, again, doesn't have to be healthcare or educational related. It could be a store in your neighborhood. A lot of places are setting up expectations, and if you don't want to follow them, those are your choice, but you need to politely leave, and if not, get help. But I think as individuals, we can make our own choices. If we're in a crowded place where people are choosing to not behave as you would like, or not act in a certain way that you would like, as you would in any situation that's non-COVID, you can withdraw yourself from that situation. And I think so, taking on that professionalism again, that's a responsibility you have to yourself and to others. If you're not comfortable in any situation for any reason, you know, you have the right to remove yourself from that situation. I think being polite and try not to be argumentative is also helpful. Just stay in a calm light as much as possible. And I think in life, we don't always have 100% agreement on things, and it's okay to disagree on certain matters. And I think, you know, there are different levels of when, you know, people need to be right or wrong, or agree to disagree. But I would just say, I would start with that. Remind people, remember, we're in a public health pandemic situation. These are the current best practices. You know, if you're at a university, I think, well, we've all seen at universities many strong statements about why it's important to act responsibly, and, you know, conduct yourself in that manner, I think really helps as well. And again, I think staying positive with a smile as much as possible to encourage the positive stimulation and positive feedback really helps. And, you know, there's a lot of negativity, there are a lot of consequences. And I saw something pop in the chat. I mean, there are consequences. And I think we just have to do the best we can with the current situation. I think, Bryan, what you said makes a lot of sense. I think people are well-meaning for the most part. Everyone's trying to make the best decisions possible to keep everyone's interests in light. And I just have to think we're all in this together has to be the philosophy as much as possible, and support each other.
Thanks, Sherry. That's super helpful. And the reframing or sort of reinforcement of the framing that this is a public health issue and this is a challenge everyone's facing, even if there are disagreements about approaches and best practices and all of that. So thank you very much. We have did want to turn to some of the broader questions, but we have a specific question from the chat. Yes, this is from one of our wonderful librarians at Seton Hall. Lisa, thanks so much for writing in. So I'll open this up to all the panelists. Feel free to jump in, but here we go. Lisa says that we hear a great deal about financial consequences associated with campus reopenings and different sort of pedagogical processes. And that oftentimes the conversation, there are folks who are not omitted to these omitted from these conversations. How do we balance these considerations against risks to health and even life, especially given the number of campuses that have already experienced outbreaks? So I'll take the moderator's prerogative, thank Lisa for the question, and say we will not this upcoming week, but the week after, engage some of the folks who are actually calling in. So Amy Debates, who's a bioethicist at Hackensack and one of my colleagues at the medical school, as well as Dean Foley, who I believe is on the call, Dean of the College of Nursing. Well, we're all going to come together in 2 weeks and talk about a bunch of these issues associated with opening schools back up. So that's my quick answer. Sort of, Lisa, make sure you turn in and I'll get you all the information. Tune in to the next one. But any of our panelists want to jump in on this particular question? We've got a few minutes left in our session. So sort of the challenges of balancing risks of health with needs to work, different structures, and the plethora of moving parts that you all have sort of highlighted in general responses to COVID.
I can take a start at this by just saying that you want to really balance the public health as well as the financial consequences that are there of opening campuses. And to that end, the kind of investment, for instance, that Seton Hall University has done in terms of preparing campuses with all kinds of technology, using the PPE and everything else, is there. At the same time, you need to really balance this with a contingency plan, that knowing that other universities, when they've opened, they've had to think of when they're going to really close. So having a contingency plan for when, should that situation arise, to move very quickly on it before it becomes another hotspot or a cluster is very, very important. So I would really address it at those two levels. And just going back to the question about the masks, I think there was a very pertinent advertisement that I saw on media, that wearing a mask tells a lot about the person wearing it, but it also tells a lot about the person not wearing it. So I think that said it very subtly. And there is research which shows that just wearing masks is something which can save lives. And this is in the region of almost 70,000 that we are talking about. So it's not something that we could just brush under the carpet. So those are two things that I wanted to share.
Thank you, Nalin. Yeah, very helpful. And the mask is such a good image for this conversation, this big question of what we owe to each other, right? Because masks are going to protect, well, depending on the kind of mask, and I'll defer to the scientific experts who'll be on in a couple of weeks for the specific details, but by and large, they're helping others more so than the mask wearer, right? So it's again, a very helpful image. Professor Cavanaugh, did you want to jump in on this question as well?
Well, I would like to weigh in on the, so the community, society's entrusted the good of health to the professionals who profess themselves, who commit themselves to serving the sick, to benefiting the sick. And that's, of course, medical doctors, nurses, physical therapists, pharmacists, and allied professionals. And of course, the question you're asking is, well, what about the other goods? The question that's being asked by the participant. What about the other goods, the goods of prosperity, the goods of education? How do those figure into the entire scheme of things, as it were? And that's certainly a correct question to ask, right? That question, of course, that's not that's a political question. That's the broad political question of that you're asking, what do we owe to each other? That's the issue of distributive justice that society really has to address, taking into account what the health professionals have to tell us, but also, taking into account what the economists have to tell us. What's the whole story, the whole picture? We have to get it from all of the professionals, the health professionals, but also other professionals. And of course, issues of justice and all those concerns, distributive justice that have been mentioned. So just to frame that question that the participant is asking. But I do, on the issue of masks, and just to follow up on what Professor Greenberg had mentioned, and wonderful, I had not realized it was the 200th anniversary of Florence Nightingale's birth. But if we think about one of the wonderful contributions, Florence Nightingale was one of the first practical statisticians. And she studied the spread of disease. And this goes to the issue of what do we say to people who say for example, they don't want to wash their hands, or they don't want to wear a mask? Well, Florence Nightingale, in her study during the Boer War, she studied the spread of disease in military hospitals and field hospitals. And she learned that it was safer actually if a soldier had been left in the field than if the soldier had been taken by his comrades to the field hospital, because the way that disease was being spread in the field hospitals. And she, in her study using statistics, she developed ways of reducing the risk of hospitals and nosocomial diseases that occur when we take care of people, and iatrogenic diseases that are caused by the healthcare professionals as they take care of people in enclosed areas in hospitals and things like that. And she wrote those findings up in her book called Notes on Hospitals. So Florence Nightingale is a wonderful example of what let's say, talk about masks. Well, we could study these interventions, washing hands, masks, and we can give evidence on behalf of these practices, and we can account for why do these things reduce the spread of disease. We actually have reasons for why we wash hands, why we wear masks, and we can give reasons for doing these things. So I think that when we speak to other people who are find it obnoxious to wear a mask, which it is a burdensome thing to do, but we can point to the evidence that we've discovered. Now, we may learn more things about the wearing of masks. We might find that some masks are more effective than other masks. Some face coverings are more effective than other face coverings. But we'll get better at preventing the spread of disease. But we have evidence that we can offer that is the result of study and the result of great predecessors like Florence Nightingale, whose example we should follow as we study, the diseases and how they spread and how we prevent them from spreading. So my message to the students is to certainly wear the mask, but study and also learn from. You'll have unique perspectives to share with future generations about the experience that you're going through, and that we can learn from our students who will see things that we don't see. Because we aren't their age going through this, and then we can use that to the benefit of future generations. So those are my thoughts on those various topics.
Thank you, Professor Cavanaugh. And I appreciate both the call to students and also the focus on reasons, right? I mean, you might even think, given the title, reasons that others cannot reasonably reject. But we're running out of time. So what I'm going to do is just ask for sort of a 30-second line from each panelist, 30 seconds at most. If you had to give one takeaway from your sort of thinking through these topics in preparation for this session, your broad work in these areas, we'll just run through each panelist. If you have one takeaway for our students, our faculty, folks calling in from all over. So we will start with Sherry, because I saw you just pop on the video. So Professor Greenberg, one takeaway comment, what can you share with everyone?
I would just suggest remembering the positive attitude, staying flexible, and then from the nursing perspective, consider things that are actual and potential health problems that you can make a difference to change for the better.
Thank you very much. Professor Johri, any final comments, a word that you can leave everyone with?
Yeah, I think what I would say is encourage everybody to try out the self-assessment related to ethics at the ACHE website. There's a lot that you learn about yourself. So I would encourage you to do that. Yeah.
Again, I said before, we're all deeply Aristotelian, right? This deep self-reflection. I love it. That's wonderful. Thank you. Professor Siracusa, a final line to leave our students, our colleagues, everyone calling in.
Your ideas, your knowledge, looking at this pandemic at this very unique time across the world, put your ideas to work, send your voice and your messages out to those of our leaders to help combat the pandemic.
Thank you very much, Linda. And we sort of got a great line from Professor Cavanaugh, but Tom, did you want to give any final word to either the Seton Hall students folks on the line, your San Francisco students, any final line for everyone to take away?
Well, Bryan, I just want to express my gratitude for the opportunity to be part of this wonderful session that we've had together. Certainly stay healthy. To the students, I would say do study and teach us what you learn, because you will learn things that we just aren't aware of. And think of those wonderful examples that have already been mentioned. Florence Nightingale, what a wonderful predecessor that we have to look up to. Hippocrates, Aristotle, these people that have preceded us, and that we just take good care of one another and stay healthy. And thank you for the opportunity to be part of this session.
Of course, thank you. All right, everyone, greatly appreciate everyone joining us. For all our panelists, I've asked folks to mute, or you'd hear an almost deafening amount of applause. Any questions, any further considerations for anybody calling in, please feel free to email us anytime at ethics@shu.edu. If you're interested in more sort of conversations, we have a series of these. One next week focused on our Seton Hall community, one the week after about reopening schools, which I've already mentioned. And you see the listserv is up there, you can get on. Anyone who's in our area, and please text IHS events. I get all the updates, they're wonderful. And do follow Seton Hall Bioethics on Instagram, SHU Bioethics on Twitter, Hall Students, and the IHS Library. And I'm very grateful for partnerships with the IHS Library, and many thanks to Allison Piazza, who has done a ton of work on this. Many thanks to Kelly Freeman in Student Engagement at IHS, who has been my longtime partner in all of these sessions. And a special thanks to Angelia Oxford, who ran all the back-end stuff for us today. So we will be back next week. Thanks everyone for joining us, and a special thanks to our panelists. Be safe and stay well.
Thank you so much, Bryan, for hosting this great series.
Thanks,
Yeah.
Linda. Thanks for being on.
Thank you, Bryan.
Thank you, Bryan.
Thank you, Bryan.